Hello, Travis from KDT Systems. So today we're going to go down through shockwave therapy. So piezoelectric shockwave devices were invented in 1980 to break up kidney stones with a process called lithotripsy. And today we use them as myofascial acoustic compression therapy to restore motion and gate pain and control pain and get patients back to life as they had seen it prior to their injury or their disability. I've been in the medical field 20 years, and focused compression is the most effective therapy we've ever used for chronic pathologies because it resets the body. So you have high intensity acoustic waves that go in the body, and piezoelectrically you can control the depth precisely, which is a very good attribute of the piezo wave. We can get down in there and create that high intensity cavitation that breaks down the extracellular matrix, which is overgrowth of re-injuries over time. Cicatrization happens, and if the body doesn't heal correctly, you have bad range of motion, and then the pathology leads to persistent chronic pain. We were so excited about the piezo wave because it could literally give patients their life back. And they've been dealing with chronic pain for years. A lot of other therapies would be palliative and pain control and inflammation reduction, but this gives a lot of patients long-lasting relief. There are different devices in the marketplace that work very well as well. The electrohydraulic, the electromagnetic. We choose the piezoelectric because of many reasons. We have not seen better results with any other type of technology on how the shock waves are generated. Piezoelectric is the most durable design by far. It has therapy sources that are dual layered. So the linear compression head treats sound compression in a line. It's actually a horizontal line that's 8 millimeters wide and 46 millimeters long. But this 20 millimeter pad can treat the whole surface area. So it's actually a very large focal zone. So for microcirculation, sports injuries, for those big muscle groups, trapezius, quadriceps, the thigh muscles, even the lumbar spine erectus, it's very effective on, even your SI joint pain. But this one's very good for your acute inflammatory issues in the big areas. A lot of other compression devices will have a small focal spot. Okay, so this is very unique to the piezo wave. This one is incredibly durable. Some doctors have reported over 20 million shock waves they'd put on the device without any repair. The F7G3 pinpoint applicator is the best choice for chronic calcifications, plantar fasciitis that's stubborn, golfers, tennis elbow, so your medial and lateral epicondylitis. But there is technique to delivering an effective treatment. So we include a shockwave certification class, which gives you certified in both radial pressure waves and focused shock waves. And it's really an art of finding the pathology, treating not only just the fascia insertion, but like the tibialis posterior, checking the Achilles attachment to the heel, and obviously the fascia insertion for that pathology. Then you go down to facet pain and different musculoskeletal issues that we can treat with the piezo wave. But the pinpoint can penetrate up to 40 millimeters. If you push pressure, we believe you can be at about 50 millimeters of penetration. These standoffs or spacers determine depth of penetration. You have different ones here. So this one's a 5, so you can treat superficially if you would need to on like a radiocarpal joint, carpal tunnel syndrome, even CRPS. You can do different treatments of like the shoulder. If you have a deep shoulder, you can go to a 20 or a 25. So the pain associated with different conditions, the piezo wave is very effective for controlling pain and restoring motion. This pinpoint applicator is great for stubborn trigger points, joint pain, and your tendinopathy. So it's very precise, and this, as I mentioned, is a deeper treatment than the linear, but they adjust the depth. Different devices like electrohydraulics, very popular. You have to turn up the intensity to go deeper into tissue, and that typically creates more pain to the patient. Where research shows we just want it to be uncomfortable where they feel it. Patient like 4 or 5 out of 10 usually gives you great results. The piezo wave is the fastest pulsing device, it goes to 12 hertz frequency. So for that microcirculation and that acute injury, it's very effective. You can turn the frequency down lower to control the pain. If you look on the right-hand side, our power bars will go from 0.1 in decimal mode. So if you have a patient that's really having a hard time with the feeling of it, you can dial it up from 0.1 all the way up to 18 bars of power, where other competitive devices only go to 16 bars. So the Piezowave is stronger and faster. You can control the exact depth of penetration that you would prefer. And it does have expert mode, so if the patient's body get used to how the shock waves are delivered at a certain intensity, at a certain frequency, you can do a ramp burst mode that will change the deception in the tissue to try to give us a result there. We have all the technique protocols included with the purchase in our certification class, as I mentioned, for 2 DCs and 1 clinician, and 1 assistant. So if you're able to delegate in your practice, we want to make sure that they're highly trained. Another reason why I think the Piezowave wins is you have a foot pedal that can control the intensity while you're working with the patient. So some patients can tolerate a lot of intensity, some patients can, they're on the lower end, so you can dial it into where you need to be. Instead of having hand controls where you got to stop the treatment and then adjust them, you can adjust the intensity while you're looking the patient in the eye, right on that exact area that you need to get to. It has the best warranty in the industry, which is 2 years or 5 million pulses, whatever comes first. And our portal has a lot of marketing and training. It truly is a turnkey system to help doctors build their practice exponentially with cash revenue. So we do have everything that you would need at your fingertips. The online course is on here. Then you would come to the hands-on portion to learn it, practice it, and get certified. And all the video training and marketing is here. We also have posters and different things showing results on bone-on-bone knee arthritis, showing that many patients get long-term relief, and you can visually show that via x-ray if you know the exact protocol on how to deliver that potent effect. So if you would like to try out the Piezowave, walk the walk, talk the talk, we will train you. We will send you one for 30 days, and then about 90% of our clients end up purchasing the device and then giving their patients many, many clinical benefits and pain relief, even long-term. So give us a call today. Our phone number is 814-754-1081. Thank you.